ahead and start recording this so we can post it on our YouTube later. So thank you all for being here today. My name is Ashton Day. I'm a health educator here at the Columbia Boone County Public Health and Human Services Department. If you hear me calling it PHHS, that's just short for our very long name that we have. And as a health educator, I help out in terms of COVID with all education materials, social media, some outreach events like this. So we're glad that you can join us. And then I will let everyone else introduce themselves as well. So Tracy, if you'd like to start.
Hi, I'm Tracy Bath. I am another health educator and I am lead on business guidance for COVID-19 and also for research. So about COVID-19.
Awesome. And Rebecca?
I'm Rebecca Rosslet. I'm the planning unit supervisor at the department, and I work with the disease investigators and the contact tracers for COVID-19.
And Trina.
Everybody, my name's Trina. I am the nursing supervisor here at Public Health and Human Services, and I also, along with Rebecca, work with case investigation and contact tracing. And I just realized I forgot to shut my door, so I'm gonna step away for a second to shut my door.
Awesome. And we'll go ahead and get started. So before we get into the nitty gritty of how COVID, how you should address it in the workplace, we are just going to go over a few of the basics. So COVID-19 is a virus that is primarily spread person to person through droplets. Those can be transmitted when talking, sneezing, laughing, all sorts of things. And so that's why social distancing and mask wearing is so important, because the further out you are from each other and the more you block those droplets, the less chance there is of exposure and transmitting a virus to somebody else. When we talk about COVID, there's two terms that you hear a lot: isolation and quarantine. These are two separate things. So when someone tests positive for COVID-19, they go into isolation, and there is a set criteria of that for when they can get released from that isolation, and we will go over that in detail in a minute. But then those who are close contacts of the positive case, those are those who might not be infected yet, but they have been exposed. So we have them go into quarantine at home because they can become infected anytime during that 14-day incubation period after they were exposed to the virus. And close contacts are defined as those within 6 feet of the infected person for more than 15 cumulative minutes. And so the symptoms of COVID, they vary a lot by person, but the key ones that you're going to look out for are those fever, chills, cough, shortness of breath, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. I share this with you. I'm sure you've all heard it a million times, but these are so important to know, especially when, as a community, we rely on each other to really self-screen every day to make sure we are not exhibiting any of these symptoms, because that's one of those signs that maybe we have been exposed unknowingly and we are transmitting the virus. So anytime you experience those, you're going to want to encourage that person to stay home because they are sick. Testing. So we get a lot of questions about testing. We as the health department do not conduct testing, but there are a lot of sites around Columbia. I'm sure you've heard or seen, MU Healthcare and Boone Hospital each have drive-through centers, and then the urgent care facilities in town as well. Many of them do conduct COVID-19 testing. To get tested in Boone County, a doctor's order is required. We recommend that you do this through your primary care physician or doctor, not only just so you can get a test, but let's say you have all these symptoms, you end up testing negative. Working with your doctor then can give you better insight into treatment or what else that illness could be. So we highly recommend you go through that. We have more information on our website if an individual does not have a doctor, or if they want to seek testing through something like urgent care, where you still get screened by a doctor or nurse practitioner to get that order. Testing costs vary by the site and insurance coverage. So if you have any questions about that, we highly recommend you talk to the individual testing sites so they can provide more information on that. And those who do get tested should be notified within 24 to 72 hours, usually. We're really lucky to have a bunch of labs here in Columbia that are pretty quick with their turnaround, but it can vary by site. So just be aware of that. So once you get tested, those who test positive will isolate at home for 10 days at least. On the screen here are the criteria that the CDC have for being released from that isolation. That includes at least 10 days that have passed since symptoms began, fever-free for 24 hours without medicine, and other symptoms have improved. This is really important because this is the symptom-based method. It is what we follow as Boone County, but it is also the only method recommended by the CDC. So what that means is that the person does not have to test negative to be released from isolation and go back to work. That's a really important change that was made. The person also does not have to have a doctor's note to be released from isolation. However, as an employer, if you wanted some sort of documentation, the health department can provide that for your employee. Am I leaving anything off there on that one?
No.
Awesome. And then for the close contacts, so those are those who have been exposed to the virus because they were within 6 feet of the infected person for more than 15 cumulative minutes, but they have not become infected yet that we know of. So they have to quarantine for 14 days. An important distinction and a question that we get a lot is, do I still have to quarantine, or am I still considered a close contact if we were both wearing masks? The answer to that is yes. Unless you're in the healthcare setting, there's a little bit different guidance for those in the healthcare setting, but outside of that, masks should still be worn. That's because while they do help keep you from getting sick, like the likelihood decreases if you're wearing masks from you becoming actually infected, it's not a guarantee. So we really want you to wear those and be extra cautious, but you are still considered a close contact. The 14-day quarantine period starts from the last time you were around the infectious person. So let's say John found out he was a contact on Wednesday, but hadn't seen Julie, who had tested positive, since Saturday. His quarantine period then began on Saturday because that was the last time he was exposed to the virus. When you go into quarantine, you are encouraged by the health department to get tested between day 7 and 9 of your quarantine period. That's because if you get tested before then without symptoms, you're more likely to have a false negative result. So let's say, it's day 3, you just really want to know if you have it because you were exposed. So you go get tested, it says negative, you're like, oh yay, I don't have it. And you go out and see your grandma, but then it turns out a few days later, you develop symptoms. You were actually infectious when you saw grandma, and now grandma's infected. So that's why we really encourage you to wait between that day 7 and 9 period, because it's more likely to pick up that positive result in there. However, you do still have to quarantine for the entire 14-day period, even if your result is negative. And that's because of that incubation time. You can become infectious anytime during those 14 days. And these close contact guidelines do apply to everyone except those who are critical infrastructure, and we will talk more about that in a minute. Am I forgetting anything on this one?
No.
This is the 3rd time we're doing this, so I feel like I got the hang of it a little bit more. All right, critical infrastructure. I'm going to let Trina and Rebecca talk about this one a little more, if you don't mind.
There's a couple of job categories where individuals are allowed to continue to work while they're in quarantine if they're not exhibiting any symptoms. Those are critical infrastructure and healthcare. The CDC has particular guidance for those 2 industries. If your business falls within one of those, you need to follow the CDC guidance for critical infrastructure or for healthcare. This does not apply to anyone who is a case. If you have an employee that is tested positive, whether they are having symptoms or not, they are not allowed to work. They are contagious, and they need to stay home during their isolation period. This only applies to employees who have had an exposure and are in quarantine and are not exhibiting any symptoms. So when this occurs, we share with the business the guidance from critical infrastructure and or healthcare, and then the employer has the responsibility to read through that information and apply those principles in their workplace for those particular employees. We get a lot of questions sometimes, from the public. I heard on social media that there were cases at this place. I don't understand why people are still working. A lot of times the reason why people are still working is either because they're in healthcare and there's a healthcare staffing shortage, or they're in critical infrastructure and they're following that guidance.
Absolutely. And then it's still really important for those people to monitor for symptoms every day, wear your mask, keep your distance, and clean and disinfect those workspaces, because again, that person can become infectious anytime. So as an employer, there's several steps you can take to keep your staff as safe as possible. These are just some of the highlights, but we will go into more detail by answering your questions here in a minute. But in general, the biggest thing you can do as an employer to keep your staff as safe as possible is to modify your operations as much as you can to keep your employees as spaced out as possible, at least that's 6 feet away from others. This really lessens the amount of close contacts if there were to become, if an employee were to become infectious. That way, if one staff member tests positive, you don't then have a ripple effect of everyone there around having to quarantine. It's just that one person that has to go home and sit out for a couple weeks. So in addition to that, trying to keep staff in stable groups is also really important if the social distancing isn't necessarily always possible. So for example, if you have prep cooks in a restaurant, you keep all those staff members as prep cooks. You don't have one shift where they're prep cooks and then they're servers and then they're bartenders and all that, because that takes them out of their stable group. And it makes it harder to identify close contacts if a person were to become infectious. And then it could, knock out your whole staff like we just talked about. In addition to that, you can assign someone to make sure all the COVID guidelines are being followed. We have a whole, I want to say it's almost 90 pages of business guidance that can be found on our website, and it's broken down by industry. And if you are following all of those things about disinfection and spacing and really those key guidance points, that is a big relief to staff to know that they are being as safe as possible. And then keeping those EPA-approved disinfectants on site and using them regularly to clean and disinfect all shared surfaces is another key thing you can do. Is there anything you all would like to add?
No.
Oh, you're doing great, Ashton.
All right, so we're going to go over a few of the frequently asked questions that we get a lot. And then if a question that you have that has not been answered comes up, you're more than welcome to put that in the chat, and we will try to answer that at the end. So number one, what we always get is, I have an employee that has tested positive. What do I do? So if this person is standing in front of you telling you that they are COVID positive, send them home immediately. They need to begin their home isolation. And really, they should have started their home isolation once they got tested and were waiting for results. So we want to make sure those people are away from others if they think that they have the virus. When it comes to you as an employer getting notified of your employee being positive, due to privacy concerns, we as the health department will only notify you if an employee has tested positive if we think that they have been infectious while working and could have exposed others within the workplace, and we need help identifying those close contacts in the workplace. So it's very possible that you, as a owner or manager, will find out that an employee has tested positive before we do. But then because of you're here, you're learning about what to do, you are prepared to how to handle it in your workplace. So if the employee informs you that they have tested positive and you know as the employer that they have close contacts in the workplace, you can choose to notify the close contacts because it can take us several days before we as the health department are able to identify all those people, just as we do our case investigation, but you are not required to. That is our responsibility as the health department to notify those individuals, but you are more than welcome to, like we said, if you know that this person has tested positive. And then you can disinfect all shared services with EPA approved products. Rebecca and Trina, is there anything from your experience working with cases?
I would just add one thing that we've talked about before, and that is to advise people to go onto the portals of where they were tested at MU or Boone, because of a capacity issue with staffing, it's becoming very difficult to call everybody back. So they are only calling positive cases. So if you test, it's a good idea to check your portal through MU or Boone. And then you will probably see those negative results in there because you will not receive a call if they're negative. So that will help expedite kind of what's going on and for you to have that knowledge quicker.
Thank you. So another question that we get a lot is, do I have to shut down my business if an employee tests positive? The short answer to that is no, you are not required to shut down if a staff member becomes infected with COVID. And that's really because of the main way COVID is spread is through that person to person within 6 feet for more than that cumulative 15 minutes. However, because of that, there are some cases if you have a small staff or wherever you work, their social distancing isn't necessarily always possible. There is a possibility that a majority of your staff could be identified as close contacts, and so that you don't have enough staff to remain open during the 14-day quarantine period. But then when a business does have an employee test positive for the virus, like I said, we may contact you just to educate and discuss on appropriate cleaning and disinfection guidelines. But it all depends on if the person was considered infectious when they were working.
So this really drives home the point that Ashton made about keeping your employees in stable groups as much as possible. What we sometimes see happen in the workplace, for example, if I'm the person that floats throughout the business to provide relief to the coworkers so they can take breaks, they can take lunch, I fill in if anybody calls in sick. And then if I'm the one who has COVID and I floated throughout your entire organization, then it could have a very broad impact on your staffing and your ability to remain open. So you want to limit that as much as possible in your organization so that if you have those employees that typically visit multiple work units, that they're not doing that, because if they should be the ones that become ill with COVID, then they've exposed all of those different work units.
Thank you. So another question, this actually was in the registration form, which I thought was really a great question. So how can we notify staff without causing mass hysteria when an employee is tested positive? I'm going to let Tracy answer this one.
Well, first, you're all on here, so you're gaining all of this knowledge, so you'll have that already prepared when you have to start notifying people, which is amazing. So thank you for attending and gathering this, because it will help, because the more knowledge you have and the better plan that you have when this happens, it will decrease the hysteria. Normalizing the virus is also really important, meaning that this is kind of where we are right now. We are seeing positive cases in businesses. And so not making it something where it's stigmatized and people feel that they can't be transparent and, tell if they've got a positive or just call in sick. That's not going to be helpful to your workplace. It's not going to be helpful in contact tracing. So just normalizing it so that people feel like they can call in and say, I'm sick, I'm going to take a test, or and not feel repercussions for that, which is why we've talked about relaxed leave policies and sick pay, because sometimes the hysteria comes from maybe loss of pay or not having the not having the days to feel like they can leave and leave home, or be away from work. And then of course sometimes it comes from them just being scared that they were a contact, which comes back to having that good plan. So we talk about prevention and risk management. So looking at whether it's a CDC link or other things we've put out in our business guidance that really helps businesses, no matter what kind of business you are, mitigate your risk throughout your business. And we've discussed that in these slides. And we also have information not only in the business guidance book on our website, but also Ashton's put together great graphics on our Facebook page, and she's made an album that people can look at as well. And finally, some of the hysteria that we are seeing is really accumulation of a lot of anxiety in general, just what's going on right now. And so we have a Como Helps Get Help website that links to different mental health services. And this is a time where I think it's a good time to normalize those as well, because there are just a lot of people who are getting so much information. They don't know what's accurate. It's conflicting. It's very difficult, which is why we're having this town hall right now. But it is really, it might be very helpful for them to talk to somebody if they, if they're very scared or they're very anxious about the situation.
Thank you. Yeah, thanks. I think that's so important. Because I think it is, it's kind of natural to be a little scared, but having all this information and being prepared is your best defense. So when an employee tests positive, are you as the business required to notify the public, or will the health department notify the public? In most instances, well, you are not required as a business owner to notify the public if an employee tests positive, because also there may be certain instances that you don't even know if the employee was not infectious at the time of working. But then we as public health will only issue what we call public health alert if the risk of exposure is high and contact tracing is not possible. So you may have seen there have been a few alerts that we've had to issue in the past couple months, and that was just in the instance where social distancing wasn't being followed, there was an infectious person on site, and they were not able to identify all those that they came around. So it's a very specific situation that really doesn't happen too often given the public health orders that we have in place, but that is why the social distancing and following those guidelines is so important. And then when should an employee be tested if they are deemed to be a close contact? This one we see a lot because I think, like I said earlier, it is our natural instinct. When you find out you've been exposed to the virus, you want to run out and get tested and figure out if you have it too. But we do not recommend that. So if there is an employee who is tested positive and they have close contacts in the workplace, send them home, have them start their quarantine, and then we recommend that they get tested anytime between that 7 to 9 days after that known contact. And that is because of the less chance of having a false negative, and then you don't go out and possibly expose others without knowing it. But like we said earlier, you still must quarantine for that entire 14 days. So even if your test is negative, you could be infectious or could become infectious anytime during that 14 days. So my employee says they are a contact to a positive case, but I haven't heard from the health department. What do I do? So this is very possible, especially considering, our employees have lives outside of work, and so they can be exposed anytime, any place. So it's possible that their sister or whoever exposed them over the weekend and they learned that they're a close contact and now they can't come into work. So make sure they are quarantining, or, make sure they are at least pointed in the right direction of the information and instructions on how to quarantine. But then we will notify and identify those people and get a hold of them. It can take a couple days, like we said, because we have to do our case investigation and figure out all close contacts. But for that reason, employers, you can identify those close contacts in the workplace if you know that an employee was the positive case. And then as an employer, you can also ask for paperwork from the health department that just says, you know, this person was identified as a close contact, but just be mindful that that can take several days before we're able to get that to them. Is there anything?
Yeah, I would say just you can request that from the close contact. Please don't call the health department and request it for your employees. That is something we can provide. We can provide documentation to cases and close contacts, and then they can then provide it on to their employer.
Right. That's very important to note for anything really, because we follow HIPAA and privacy concerns. So we're not going to be giving details of these patients to you as the employer. We will work with the case or the contact for them to then give it to their employer. All right, that's all I have for our scheduled questions. So if you all have any, please leave them in the chat box.
I did want to mention one thing. We talked about the close contacts being, within 6 feet for more than 15 minutes and that sort of thing. I don't think we mentioned on this one that when we're looking for close contacts, we are going to go back 2 days before the person's symptoms started. Or if there's someone who tested and they were asymptomatic, maybe they were a close contact to another case or something, we would, and they haven't had any symptoms, we would look back 2 days before the date of their test. And so anybody that they were in that close contact with 2 days before symptoms started or 2 days before their test date, depending on the situation, up until the time they found out they were positive and started isolating, those folks we would consider close contacts.
I would like to just give an example of the cumulative 15 minutes of exposure. So close contact is within 6 feet for 15 minutes or greater, and that 15 minutes is cumulative. So if Trina and I worked together yesterday and I found out later I was contagious, and Trina and I I was only in her office for 5 minutes, but I did that 4 times. Trina's had more than 15 total minutes of exposure to me on the day that I was contagious. So Trina would be a close contact and would need to quarantine.
We have a question. So if an employee does not have a primary care physician, who should they see for requesting a test?
Excuse me. So there's options through MU for them to do a virtual visit, or urgent care can do the testing for them as well.
We'll wait a couple more minutes. More questions. Yeah, Tracy.
Yeah, so contacts of contacts is another frequently asked question. So if my daughter tests positive, I have obviously lived with her, but I have not tested positive, I'm going to start my quarantine. But the people that I've worked with, they are not considered close contacts, not yet, and they may not be if I've been quarantined and wasn't infectious when I was at work. So just because someone at a workplace is a close contact to someone else doesn't mean that within the workplace, everybody they've worked with is also now a close contact. We have to wait for the close contact to have a positive test before we start investigating what happened in the office. So I hope that makes sense. So I know it's, once you hear someone's been a close contact, then you start thinking a lot of things. But as far as when was I with them, but we really do not look at someone that's just been in close contact with somebody as someone that you need to start a quarantine just because you've been around them. We do need to wait for them to have a positive test. I don't know if you'd add to that, any of you, but it's a frequently asked question.
Yeah, it's a great thing to go over. And I think, I think that kind of plays into just, I don't know if I would call it fear of the virus, but yeah, you find out someone was exposed and it can get kind of confusing on if then it was passed to you. So it is an important distinction that until that person tests positive that you had contact with, you are not considered exposed and do not have to quarantine or do anything extra special unless that person.
But yes, but we would remind everybody to every day monitor their symptoms in general, just because we never know who we are in contact with sometimes. It just, obviously we have to be with them for at least 15 minutes cumulatively, But there are just times, whether it's, your children, your household contacts, or people that you work with that you don't realize you've cumulatively spent 15 minutes with, until you kind of look at it and add up your time with them. So it's just important every single day to monitor the symptoms of COVID.
Does anyone else have any questions in the chat? I'm not seeing any, but you're welcome. Someone said thank you.
Well, go ahead, Ashton.
Oh, no, you go.
I was just going to say, while people are thinking of them, and if they don't, that's fine. There's a couple things I wanted to say. First, we do have an email, businessguidance@como.gov, where you can ask questions about anything, like a plan that you have for your office. If you have questions about it, or you just have there you go. And you just have certain questions that you want to know about safety or anything else for your office, we're happy to answer those. And I just wanted to thank everybody today for coming, because it really means that you are looking at this, trying to do prevention, trying to figure out how to make your office or I keep saying office, I'm sorry, your workplace as safe as you can to mitigate the risk of COVID in your workplace. And we also just appreciate all of the businesses that we get emails from that are doing their hardest work to manage something that we couldn't even fathom wrapping our heads around. We had to wrap our heads around it really quickly to give any kind of guidance to businesses. And we know that that is just not normally how you think mitigating a virus like this. And so, we're doing our due diligence to get the best guidance we can so we can give it to you, because we realize, to all the businesses, because we realize it's a lot to wrap our heads around, and we're here to help.
We do have one question. Do you have any recommendations for dealing with employees who are traveling?
That's going to be up to the business. You can set your own policies through HR, and obviously I'd always recommend, if you have, someone legal, just to make sure that you feel comfortable with all those things. That's not in what we don't make any recommendations like that, but it just obviously it depends on what they do too. I mean, someone traveling and doing a lot of things that put them at higher risk is one thing. If somebody travels and they literally take an RV to a campground, don't see many people, and come back, there's differences, and you're not probably going to quiz your employees, not all the time, but just if they do leave town and come back, definitely have them monitor their symptoms, and just have them keep an eye on that. But for CDC, there is no domestic quarantine. Some states have required it. Our state has not, but there is some international quarantine. But because it's not CDC recommended, and it's not part of any order put out through Missouri, we cannot recommend that, but we can just ask you to continue to ask employees to monitor their symptoms, and to also I think it's okay to tell employees, just while you're not here, be mindful of mitigating your risk in your personal life. I don't think that's wrong to say, but it's just hard to decide how you're going to put that into a policy for your business.
I think if you're sending an employee to another location for work purposes, it would be maybe a good idea to look on the county health department of the county that your employee would be traveling to get an idea of their active cases. Do they have community spread? And does that county have any things in place where they may say, if you're entering our county from somewhere else, you need to quarantine for 14 days. Because if that's the case, then it's unlikely your employee would be able to do their work once they arrive at that destination. So I would just do a little looking at the destination's information that's available on their websites to make sure that it's going to be a fruitful trip for your staff.
That's a great point.
That is a great point. I even had a friend who was looking into going to Chicago, and then heard that they have the travel ban or quarantine for people coming from Missouri. So they decided to cancel that trip and just stay in the state, actually. But yeah, it's something to look out for. And I think more and more states are doing that and announcing that. So just keeping up to date on that is really great advice. We have a question. I'm not too sure of this answer, actually, but can you share if there are specific workplace industries that are being spread among coworkers more than others?
I think you've seen in the national news and the Missouri news that the ones that we seem to see in the media are the food processing locations. Those are workers that are within close physical proximity to one another. I don't know if we have a lot of that industry in Boone County, but that's one particular industry that we've seen a lot of state and national coverage on.
Absolutely. And you can, oh, go ahead, Trina.
I was just going to agree with that. I think any industry where physical distancing is not possible, there's a higher risk for more transmission.
That's exactly what I was going to say. Well, that's all the questions I'm seeing right now. Again, if anyone has anything that they think of later, you're more than welcome to email us those questions at businessguidance@como.gov. We will be posting this set of slides to our website later this afternoon. We want to make sure it's all as comprehensive as possible based on these discussions before we post. And then we'll probably put this recording up on YouTube as well, so you can watch that. And I think that's all for now, but thank you so much. And again, we are so appreciative of everything that you all do as business owners. You are key stakeholders in our fight against COVID, if you want to call it a fight, slowing the spread. And we're very appreciative for all of you all. So thank you so much.
Yes, thank you.
Have a nice day.